Today we are here for our post-conference series for ViVE 2026. So it was wonderful connecting at ViVE 2026 and inspiring to see many leaders driving innovation in digital health. So as a part of the post-conference series for ViVE 2026, we have Chandra Osborn at PharmaShots here, and she is the Chief Experience Officer at AdhereHealth, and she is a nationally recognized behavioral scientist who is specialized in patient engagement, medication adherence, and value-based care. Welcome, Chandra, to this interview series.
Thank you for having me.
Can you tell about yourself, and then you can talk a little bit about AdhereHealth so that our viewers can know about you and the company?
Absolutely. I am a behavioral scientist. I've spent my career focused on medication management and adherence in high-risk populations and using technology specifically to engage and drive adherence in those populations. I've had the pleasure of working with AdhereHealth for the last year and a half. We're a 20-year-old company as of this year, and we use technology and clinical teams to support medication management, medication adherence, and closing care gaps in Medicare Advantage populations, Medicaid populations, and dual eligible populations.
Let's talk about a little bit about yourself. How is your journey so far? And then we'll talk about the Adhere Health.
Yeah. Well, as you mentioned, I'm a behavioral scientist. My background is in health psychology. I've spent my entire career
Mhm.
applying best practices for engaging populations to improve medication management and adherence in high-risk populations, which brought me to AdhereHealth because we specialize in just that.
Perfect. Can you tell us a bit about Adhere Health? How
Absolutely.
it's formed, and then what exactly it is doing in the healthcare sector?
Sure. So AdhereHealth is a company that is just this year 20 years old. We have been serving different populations, largely in the payer space and government plans where we are supporting Medicare and Medicaid and dual eligible plan members in
Mhm.
achieving adherence as well as closing gaps in care.
All right. So let's talk about the technology because the vibe was mostly about the implementation of innovation or technology into the healthcare sector. So after vibe, what stood you out about how AI is currently being used to improve patient engagement?
Well, what stood out to me the most at ViVE is that the conversation about AI is clearly maturing. Um, there's a focus that's kind of shifting away from what AI can do and what it should do,
Mhm.
and sort of what it shouldn't do. Um, so the most, effective use cases that I encountered, they weren't super flashy or, fully automated. They were very focused and targeted, helping teams prioritize or reducing administrative burden. Also improving the timing of how we outreach to patients and engage them. And so what I saw a lot of was that AI is really working a lot behind the scenes to make that human interaction and relationship more
Mhm.
effective.
Mhm.
Um, what's still not working well when it comes to AI is, really still can't replace that trust and empathy, or, fully clinical judgment. And
Mhm.
so having that automation with the human touch or human element is really key. And I think what the focus is now is how do we marry those two in a very thoughtful way?
Yeah, that makes perfect sense here because it will take some time to make it like to come up with a trust and trust build up with the time. So trusting in AI will take time and obviously the technology is going to refine
It will.
itself. Yeah. Yeah. Okay. So talking about the behavioral science and implementation of behavioral science with AI-driven outreach, how you see this that the combination of behavioral science and AI-driven reach is actually helping the patient?
Yeah. Well, when it comes to patients, we've all been a patient. We're all human beings. And behavioral science is the study of human behavior. And so, what behavioral science does when it comes to AI is it gives AI context. Without it, AI is really just optimizing at scale, moving faster, um, and louder, and it's often sort of easier to ignore. But when we apply behavioral science, we're designing, in a very thoughtful way around how people make decisions, how they actually behave, especially, when you're a patient and you're under stress or, cognitive load where you're very much, consumed by a lot of other thoughts. And so we have to simplify choices. We need to use the right framing. We need to anticipate barriers or learn what those barriers are and help patients overcome them. And we really need to meet people where they are emotionally and cognitively, not just clinically. And so AI can help us decide who and when should we engage. But behavioral science really shapes, how we go about engaging with people. So the message, and the conversation is relevant and it's respectful, and it actually helps us achieve what we need to achieve in driving patient care and outcomes.
So medication adherence is one of a big challenge because obviously that's human nature to push something which you do not like or you do not intend to.
Mhm.
Then how like as per your understanding how the medication adherence has changed over the period and how now technology is helping people to adhere to their medication.
Yeah, medication adherence continues to be a big challenge. And I will self-disclose that the reason why I got into this area was because I was a patient who had a really hard time taking this medication that I needed to take. So we're all human. We all encounter challenges and things that get in the way of our success. And so the strategies that we need to employ are those that remove that friction, remove the cognitive load or whatever's in the way of the success. And technology can really serve a valuable purpose there. It can help us know like how we right size our engagement with patients. We can monitor who's adherent and who's not. And so we can
Mhm.
be very specific around who we contact and personalize our engagement or outreach based on those patients who aren't taking their medications or who are more at risk given their other characteristics and health conditions. It also means that we can, when it comes to marrying technology and human interaction, like I suggested earlier, that's where we get into some of the real challenges that a patient has, where we can have conversations to understand that it's not just, I'm busy, I forgot, but I can't pay for food. How am I going to pay for my medications? And so we can't just default to using technology to remind people to pick up their medications or to take their
Sure.
medication. We
Mhm.
really can't just ping people to take their medications with technology because there's so many layers that need to be addressed.
Okay. Let's talk about some of the factors, like human factors. Why humans are not adhering to medication.
Yeah.
One example I can talk about is obviously the elderly population, they have difficulty in managing it. But then apart from that, what are different factors which you can talk about?
Yeah, there are many and they're
Mhm,
multi-layered. Um, there are factors that are specific to the individual. That's when we think of cognition, we think of motivation, we think of ability, we think of, the health condition of the patient. There's layers beyond that, your support system, your your social network, your family members who are helping you. And then
mhm,
there's even more layers beyond that, social risk factors. Is there a pharmacy close by? Is it, a very kind of low in community where it's hard to deal with some of the challenges that are associated with that. So there are tons of factors that are we consider determinants of medication adherence and also barriers to medication adherence. And so we have to marry technology and clinical conversations in such a way where we can peel back that onion and really learn what's in the way for each individual because they're different. There is no one size fits all reason why people don't take their medication. It's very personal and it also changes over time. And so we have to have solutions that are dynamic and can respond to the changing nature of people within their social context. And technology has a huge role in that because it can help us do that more efficiently.
So, does it help for the designing patient engagement workflows for you with those factors in mind?
Absolutely. So when you're designing a workflow, whether it's for the patient or the clinical team, we need to design it in a way that reduces effort, that offers clear steps so that it's easy to execute. We need to allow for flexibility because, as I said before, no two people are the same and we have our own preferences. So that might mean fewer communications or more choices or prioritizing, different ways of supporting people and using more human touch when the situation is very complex. So ultimately, what we're trying to do is, make the right action easier than doing nothing.
Absolutely. So, as you were there at ViVE 2026, can you talk about five technologies or uh, upcoming technologies which are actually going to improve the uh, patient outcome? So we can talk on fingertips that five technologies which are going to change the world in terms of healthcare.
Yeah, I hope I can get to five, but I do
Yeah,
see a lot of potential with AI and behavioral science coming
yeah.
together.
Mm-hmm.
Leveraging AI when um, it comes to those activities that are below a clinical license. So again, any administrative tasks or some, more menial tasks so that
Yeah,
it
yeah.
relieves the clinical team. Um, I also think there's going to need to be more personalization with technology.
Yeah.
That's really going to drive better outcomes. And we also need to be um, very thoughtful in how we go about governance and monitoring and ethics when it comes to those technologies. I think there's a lot of potential for digital therapeutics. It sort of had its heyday and then kind of faded,
Yeah.
but there's now a lot of energy and effort that's been revitalized in that area. And so I
Mhm,
think we're
mhm,
going to
mhm.
see more companies, again, using technology
So,
and humans to support the management and care of patients.
all right. So, any future trends which you want to comment on in terms of adherence, helping?
Yeah.
the population?
Well,
Yeah.
so, if I can look ahead and sort of cast a net of what healthcare organizations should prioritize if they want to improve patient outcomes, which is really what we're dealing with in the Medicare environment right now, and not just short-term engagement. We're really trying to drive more longer, sustained, better health. I think it really comes down to aligning technology, the clinical strategy, and also the human experience. We need to prioritize measurable outcomes over sort of the very surface level engagement. We need to invest in programs that scale without losing empathy. And we also need to respect the long game. So continuing to build relationships, trust, consistency, and being relevant in people's context, in their current moment in time is going to matter more than other ways of responding.
Thank you, Chandra. Those were my all of the questions here. And if you can give a little bit detail about if someone wants to, some program manager wants to reach you out, how they can reach you here.
Yeah, you can find me on AdhereHealth's website. I'm also on LinkedIn and would love to connect.
Perfect. It was nice talking to you, and I look forward to connect you again in our next conference. And for our viewers, thank you for watching the post-conference series for the ViVE conference. And we'll continue to add more interviews. We'll bring more interviews to you. Thank you.
Thank you.